Hello viewers and welcome to Medgate Today TV Digital. Today we are at 7th edition of Thought Leadership Summit, an initiative by HOSMAC, and Medgate Today is proud to be the media partner of this wonderful event which is having in such a beautiful place, Jaipur, the pink city of India. And we have Dr. P.R Sodani sir, who has just delivered a wonderful panel discussion, being the moderator over there, taking out the deliverables from the best minds who are giving their best to the healthcare. Sir, you just talk about how we can make India beyond, not only to tier 2 cities, tier 3, but beyond to India, making it global. So please first let us know what kind of challenges, what kind of hindrance the tier 2 cities and tier 3 are facing and how we can debar it.
Well, so to provide the healthcare services to the smaller cities or the villages, there are a lot of challenges we are facing nowadays. One of the most important, challenges maybe like capital related, human resources related, and also the cost of delivery. That is also one of the challenge as far as I see. But to provide the healthcare services at the masses, even at the smaller towns and villages, it's very, very important for Indian population. Since we are growing and we are spread across many states, and there are many geographies, rural, urban, semi-urban, and all these things. So keeping those things in mind, the healthcare providers or the healthcare industry, either it be the public sector or the private sector, they should come forward to move forward their capabilities, their capacity, and their talent towards the lower level cities, so that they can provide affordable healthcare services to the masses. As we all know that the out-of-pocket expenditure is used in the healthcare sector, and the population in India, they are sometimes facing this as one of the major challenges to seeking the healthcare services. So the challenges are there, but there are models that how we can go ahead and what is the way forward. The thinking that one issue or one solution maybe like that we can improvise on various models of public-private partnership. I would suggest that since the government has its own legacy in the healthcare environment, and they have their own credentials, they have their own strength, but at the same time the government also have some concerns like to provide the healthcare services. But at the same time we have a huge private sector in India. It's well developed sector. There are competent people, there are capacities, there are capabilities, and there are talent in the private sector. So now the issue is that can we thought in a bigger way that what are the ways that public sector and private sector come together and provide the healthcare services.
Exactly.
By this we will be achieving our national goals very effectively, and scaling is also another concern. So the private sector joins hand with the government sector, they can operate at a scale.
The name is collaboration.
Collaborations and partnership.
Exactly.
So that is the way.
So as you are the president of IIHMR University and you are bridging the future of the nation, so how you are preparing the students to not only move into tier 1 cities for the better opportunity, but please give your service to the tier 2 and tier 3 cities as well?
Very good question, and I think the answer will be also satisfying to you. That IIHMR University is one of the premier institution in the healthcare management education in the country, and we have been ranked number 1 healthcare management university in India. As far as our students are concerned and our teaching pedagogy is concerned, our teaching pedagogy is very unique in IIHMR. Most of the time we think that the student can be trained and groomed if they go outside the classroom. So we prepare the student by the concept clarity in the classroom, but at the same time that how as a program manager, how as a industry leader, they will contextualize that concept in the healthcare industry environment. So the student goes to the village level hospitals, public healthcare institutions, government institutions, private sector hospitals, and try to see that what are the real challenges of the healthcare industry and how they will be able to support the healthcare industry when they go and place in the industry after the 2 years or completion of their degree. So students are always, there are a lot of opportunities for the student. We create the opportunities so that, and also when they go to the field, again, it's a very structured program, what we say, that they come from the field visit or exposure visit, then they have to, present in the class that what are the solutions for this problem. And the whole class, it's a very participatory approach. The students can interfere, the student can question and all these things in front of the mentor and the faculty. So I think we are helping the country so that we can move towards non-metro cities, or we can move from metro cities to the non-metro cities, and the students are groomed on various skill set like leadership, managerial skill set. Analytics is also important nowadays, how to utilize the data for decision making approach.
Exactly.
So we are giving lot of attention to our students that you learn these skills. The analytics is very, very important. Unless until you analyze the data, as a manager, as a leader, you will not be able to take a right decision.
Exactly. Well
so
said.
These things are, integrated in our, courses and pedagogy.
Yes. Very well said, sir. The core of learning at your university is very clear that first you are making the concepts very clear, and after that you are making them to execute on the real ground. And the kind of things you are saying, that analytical data, you are making your students to go beyond the technology and match the current situation and make yourself updated with the same. My last question to you, how you are seeing this event, how you are giving the thought of Leadership Summit?
Yes, this Leadership Summit in Jaipur, it's a wonderful program, and I enjoyed this program. I enjoyed my session which has been given to me to moderate the session.
Yes.
And the delegates they're all very, it's a power-packed session, I would like to say. So thank you so much for arranging this session, and we expect that such sessions be continued for the industry benefit.
Definitely.
Thank you.
Thank you so much, sir. And we will be looking forward to hearing a lot of insights from your side, not only to this event, but also in the future events. Thank you so much.
Thank you so much.